Well, 15 minutes in, we got to get started. We're going to finish this up. We're going to review tomorrow. I'll put the review on the website tonight, so that way you can another night. Angel Fire. Huh? No, we don't have school Monday. So it'll be on Friday. Okay? Well, then you'll make it up at some time. We have in-service. And it's probably Valentine's. You know, that's one of those crazy holidays where people don't like to get up out of bed. No, you can. You can. Yeah, certainly. You can always take it early. You want to take it now? You can just take it now. All right. Yes, certainly. All right. So cryotherapeutic methods. Okay, so we know cryotherapy is ice. Okay. Well, ice cups. You guys see ice cups, right? Where do you find them, Joseph? Yes, an ice freezer. Some people call it the ice cup maker, etc. Ice box. Yes. All right. So ice massage used over small muscle areas, and seldom is there tissue damage because you're constantly moving it. Okay. The other thing about an ice cup is that it's a shorter duration of therapeutic time. So using an ice cup, you're only going about 6 to 7 minutes, as opposed to an ice bag, which is 20 minutes. Why would an ice cup be less time than an ice bag? It's right on your skin. Yeah, well, let's go back to our and thought. Well, true, because the other ice melts, and then, but there, the insulation part of it, which is air, there is none. So ice melts just like on that wet ice, and so it's going to be less time for it to get to your required numbness. So cold or ice water immersion. I'm not a big fan of like ice water immersion. I think that it needs to be at the absolute less, at least is 50 degrees. You start getting into this craziness where you're saying, well, I'm going to put it at 40 degrees or 35 degrees. You're going to end up freezing tissue. And that's not a good thing. You're trying to help the athlete, not punish them for being hurt. Although there are those that say, well, we're going to stick your foot in an ice bucket till those little toes get frostbite. And yes, they can get frostbite. All right? So, cold or ice water immersion is you place the limb or injured anatomy in 50 degrees of water. All right? The collagen becomes brittle, and care must be taken if returning the athlete to activity after therapy. Right. Collagen is what fills in for scar tissue. That's the scar tissue is collagen. When you get a muscle tear, it doesn't fill in with muscle, it fills in with collagen. And it bridges that gap. Okay? So now I'm making it brittle. I go out to practice, I go out to run, I pull it again. And so now I pull the collagen off of where that tear was before, and we're right back at square one. So that's not a real bright idea. Right? And then you can use ice bags. We talked about the wet ice is best, but it is messier. But chemical packs, those little deals that, pop them and put them on. I think every little league team has one or two that's got more dirt on it than what it needs. Uh, but you never know exactly how cold that's going to get. You know, ice is 32 degrees, and it's not going to stay there because as soon as it's going to be melting. All right, Basal coolant sprays. Now, if you watch baseball at all, you see somebody get hit with a pitch and and they pull this silver tube that looks like the beta capsule from Ultraman. Although that's way before your time, right? Yeah, you know what I'm talking about. Well, check it out. He's on YouTube. All right. So the beta capsule. Anyway, looks like it's a long tube. And at the top of it, little nozzle. All right, and they turn it open and just puts super cold spray on you. Somehow we've got this cold spray It's not as cold, I don't believe, as what the others are. The other's a lot colder. This is cold, but the other stuff you need a prescription for. This you don't. Now, you hear when we tape ankles, they go, "It's cold," right? So why is it that something in a can is going to be cold anyway? Huh? That's the compression, and then the pressure differential. When you compress something, you're putting more atoms and molecules into a smaller place. So you get, excuse me? Yes, you get heat. So think of this. You go walk this summer when you go inside and it's cool because you're running the air conditioner, right? But you go outside and you walk past the air conditioner and it's blowing out hot air. But on the inside, it's blowing out cold air because you're condensing those molecules, which is going to cause heat. So you got to get rid of that heat or your condenser is going to blow up. But then when it's released and the molecules, you take condensed molecules and put them into a bigger space, that causes cold. So there it is. We can condense this, and then we're uncondensing it. Now, as it says on here, you're not going to know exactly how cold this is. So it says it will get cold enough to do skin damage, and I very well may have done it. But I have seen it to where it will blister. Somebody used the other good stuff, and it will blister your skin if you put it on there for too long. But you can use a Basal coolant spray to help increase your range of motion. And you see it a lot at baseball, some at hockey, not so much in football, and not so much in a high school setting. Again, you got to have a prescription for it. And there's not too many doctors who are going to say, oh, yeah, these are kids, and we can use this stuff when there's other options that are more viable and easier to use. Yeah. So if cryotherapy is cold, thermotherapy would be, yeah, you're using heat. So heat is an energy form that increases molecular activity by conduction, convection, and radiation. All right? Conduction, convection, and radiation. Thermotherapy modes are moist, dry, superficial, and deep. All right? So they can also be a combination of such. They can be a combination not of moist and dry, but they can be moist and superficial, dry and deep. Okay? So the desirable effects of heat include increasing the extensibility of the collagen tissue. So that's why we use heat before, ice after. As we have learned in our previous lessons, is that for every degree of internal temperature that we increase, the metabolism increases 13%. Well, we're going to start increasing our metabolism. That means flexibility is increasing, the internet between your brain and your muscles is increasing. So it's a good thing. All right, decreasing, so it also decreases joint stiffness. It helps reduce pain. What also is a pain reducer? Very good. Advil. What else? Cryotherapy. Ice. Ice is an analgesic. Remember we said that? So is heat. But the thing about it, though, is if you use heat for a pain reliever, yes, it feels so good, but it also is a vasodilator. So now we get more junk, we get more blood, we get more histamine release and so forth. So then this swells up. Can't tell how many times that somebody comes in, they sprain their ankle, and you know right off the bat, they went to grandma and grandma said, put it in warm water and Epsom salt. They do that, and it's twice the size of what it should be. And now they're going to be out of playing athletics a week, maybe 2, maybe 3 weeks longer than what they should be. So So it reduces pain, it relieves muscle spasm. Oh, so does ice. It reduces inflammation once the inflammatory stage is gone, not in the initial phase. All right? Edema, and it allows swelling to spread out in all directions in the post acute phase of healing. So then it increases blood flow. Just like the guy who had his bursa here, and we iced it, and we couldn't get anything out because the call it that that bursitis. This is the synovial fluid just turned into like a real thick jello. Now we put heat on it, it's going to be really loose, and we could have probably gotten it all out. So thermotherapy. You get muscle cramps caused by ischemia, and that can be relieved by heat. So we got to know where the ischemia is, right? It, it has something to do with your butt. How'd you know that? Oh, well, yeah, it says it right there, doesn't it? The lack of blood supply to a body part. Very good. So if you're anemic, huh? Anemia, you have anemia, ischemia. So anyway, that's why when we're talking about you, especially those of you that are working track, you start seeing these people that say, "I got shin splints. Please tape my shins." Well, yeah, you can tape your shins, but it's got to go around the calf. If I go around the calf, I'm going to reduce the blood supply. I'm going to get muscle cramps because I'm taping their calf. That's why when we tape ankles, we only go up until we get to the muscle belly of the calf. Doesn't work otherwise. So there's special considerations for thermal therapy and places you never apply to. Holy smokes, this really looks like a, I bet it is. I bet it's a listing question. I know, it's a list. Never put it on some place you have a loss of sensation. Why not? Because, what was that? Exactly, you can't tell if it's burning. When we put this on, the hydroculator pack on, what do I always tell them? If it feels like it's burning you, it's because it is. Yes. So immediately after an injury, we don't want to recruit blood to the area of an acute injury. So we're not going to put heat on there then either. When there's a decreased arterial circulation directly over the eyes or genitalia. No, I'm looking for surgery. Immediately after an injury. Yes, we talked about that. All right, over the abdomen during pregnancy. All right, cooked babies are not good babies. Okay. Yes, don't have a microwave. Yes, well, it is, but it doesn't need extra cooking. Okay. All right, and don't and on a body part that exhibits signs of acute inflammation. So if it's already red, if you touch the body part before you put heat on it and you can feel a fever, these aren't things that you're doing. You see it's already swollen. No. Common sense will tell you these things. And so the one little deal that I'll tell people is that if you're questioning whether you need to put heat or ice on something, go with ice because there's so many more things that heat are going to mess. Yeah, you'll mess up. You can hardly mess up with ice, hardly, but you can mess up more with heat than what you can with ice. So that there is a gorgeous listing question. Okay, so we have the hydroculator. This one they call it a thermolator. It's called moist heat packs. So there it is. It's moist heat. All right. Is it deep or is it superficial? It's superficial. All right. That's what did we say this was? 170 degrees, I think it was the other day. So that's pretty warm. 120 degrees is scalding. So now you're 50 degrees over that. It will. You put it on there, it will blister you. It will probably give you certainly second degree burns if you sit there and want to go through that kind of pain. All right. You'll retain the heat. Well, we talked about Stella, and we know that that wasn't Stella didn't purposefully do that, and that it was actually was an accident. Yeah. So the hydroculator, it'll retain heat for maybe 20 to 30 minutes, maybe. Remember, we have fat, and fat is an insulator. and it insulates more against heat coming in than cold coming in. We just talked about that. Heat, so it's between 160 and 170 degrees, and careful not to burn the athlete. Always, 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 no matter how many times they've actually come in to get a hydrocollator pack, always tell them, if this feels like it's burning you, it's because it is. All right? Whirlpool bath, 104 degrees. Be careful with full body immersion. Why do I need to be careful with a full body immersion? I'm going to their back's bothering them, and I get them up to their clavicle, and the only thing sticking out is their neck and head. So why do I need to be careful? 104 degrees. It's not even scalding. I'm doing all right. Yes, they can faint. How do you know that? It is like a hot tub. 104 degrees. So what's higher is I'm 98.6. When I have heat, it recruits blood. What part of my body is now the coolest part? And if I have less blood to the head, I have less oxygen, and it makes me faint. Yeah. Yeah. And if yeah, you felt better, I'm sure. So keep water and whirlpool clean, and also change the water often. You should always, always, always have your whirlpool to where you're able to see it. So if somebody's in there, you need to make sure you're there. There's somebody, matter of fact, that looks a lot like ours, but it's not. Paraffin. What's paraffin? Hot wax. All right. Pass this here. There we go. Now we can go on down. Paraffin. That's what paraffin looks like. It's when you get a pedicure, they do a paraffin bath, and it feel pretty good, nice and warm. Yes. So it's, as you can see, your temperature is 126 to 130. You need to know these temperatures. All right. Good for heating distal extremities away from the heart, and it's on your extremities. Great for hands. Now, my dad had one that was like, he had a paraffin bath that was like the size of this thermolator. Most of them aren't that big. But when you have an unlimited budget, you can get things like that. And during the real cold games in Philadelphia, well, not just the wide receivers, but especially them, they would come in, and that's how they would heat their hands up. The only thing about it is that then you get that waxy stuff on it. So then they would have to put on. This was back in the day when they wore like scuba gloves. They were pretty cool. So paraffin bath is good for heating distal extremities. It's hot wax with some mineral oils in it. And it is, you take it and you would dip it in, dip it in, dip it in about 5 or 6 times. And then you make a sandwich. You put one hydrocollator pack down. You take the hand, put an ice bag over it, just the bag, put it here, and then put another one on top. And so you'll certainly heat up that distal extremity by making a paraffin bath sandwich, as what's his name would say on the Dynasty of Ducks. You can also use a contrast bath where you alternate between cold and warm whirlpools, and it's used when a slight increase of temperature is needed without what am I writing here? Used when a slight increase of temperature increase is needed without an increase in additional edema. In other words, okay, we got the kid, that one kid, he sprained his ankle. I think he plays soccer. Is that right? And he's got all this nasty coloring on the side. So he's going to have some time, need some help to try and get rid of this edema. All right? So if we go 1 minute of cold, 3 minutes of warm, all right, and do this for 5 cycles. It takes us 20 minutes to get it done. That's going to help the lymphatic system and just the circulatory system. Go in, grab it, push it up. Go in, grab it, push it up. And so it'll help get rid of those residual edemas. You hardly see it. The junk that's in your, that's by the joint when it has a sprain or etc. That residual swelling. You know, you get a bruise and it turns black and blue, and then it ends up turning yellow. Yeah, sprain your ankle, it's black and blue, then it ends up turning. Yeah, so that's the fun stuff. All right, so both heat and cold will relieve pain, so they both are an. So you should know that the next word starts with a vowel because I said a analgesic. Yes. All right. There's too many old remedies of heat during the initial phase of recovery that are still being used. Don't. Whatever you can do, convince your athlete, not heat that you want. A lot of times it's not just the athlete you have to convince, but you got to convince mama or grandmama, grandpapa, because they're going to insist that, oh no, we got to put him in some type of poultice and hot water and this, that, and the other. All right. Tell the athlete that under no circumstance that heat is to be used during the initial phase of injury, and that's going to be anywhere from 48 hours, 72 hours, sometimes as much as 84 hours. So there we go. Who's got questions on this stuff? The temperatures will be on the test. It will, if I remember correctly, the temperatures say that you'll need to pick the temperatures in a multiple choice. No. All right. I think I have this one to put online. It'll be online as soon as this one is done rendering. It'll be online. So, we got questions about this? You must have questions. Question?